I am Darlington, Chikami. I represent Windows of Hope. Windows of Hope is an organization that works with orphans and sick people in the community, whereby we try to address problems that are encountered by orphans and also the sick people in the communities, as well as empowering communities to do income generating activities. Okay, the major key impact was the loss of income. The livelihoods of the households, they were very drastically affected because of loss of jobs and income from businesses, and also the child marriages that were experienced during the lockdown. They affected the communities. Yes, we have identified those people who have business ideas and they lacked a capital to come up with something, and we gave them some startup capitals and also trained them in digital marketing so that they could also market and sell their things through especially the WhatsApp platforms. And we also had to engage our stakeholders in the communities. We work with volunteers who visit these orphans and vulnerable children in the homes. So we engaged these on WhatsApp platforms to try and give each other ideas how to help, because they were reporting to us that a lot of them were getting married because of just idleness. Yeah, we experienced a lot of referrals from the Department of the Social Services Department and the hospitals who were seeking assistance for the children who were being left behind by their mothers, either just after birth or during birth. The mothers would have passed on, and some mothers could not lactate because of health problems. So the number grew, especially during the lockdowns, and we had to chip in and to try to buy and supply formula milk for such children so that we could save life. But it was really a challenge because a lot of those cases were coming to us, signifying that this is one area some partners can also come in because we're overwhelmed. From March 2020 to date, we have assisted, we could say, more than 126 infants in that area. Yeah, I have also learned that we need to be very innovative in some situations, because some disasters just come without us prepared for them. But I would just hasten to say we also try to do that during the lockdown, because under our vulnerable children interventions, we also run holiday camps with orphaned children, where we try to equip them to be useful citizens. We would be teaching them life skills lessons so that they can also be prepared to. So we could not gather children because we normally gather 150 per week. It's a week's program where we have trained facilitators teaching these children and also feeding them at one venue. So we could not gather these children because of the restrictions. So, but we also thought that these children are also vulnerable because of the pandemic, and we had to change and maybe talk with the partners to say, this money we are no longer going to use it for camps, but we can also buy some PPEs for these children so that they can also go to schools when the schools were opened. I would also want to just highlight that in our community health care department, we work with the sick people in the communities, where we also encourage them to participate in support groups, so that they can also share and exchange ideas about their conditions. We have helped quite a number of cases of cancer patients who wanted to go for chemotherapy and radiotherapy. These are some of the things that we did during the pandemic.